And we're going to be talking about this with Dr. Jean, who completed her doctoral degree in clinical psychology and is an assistant professor at Morehouse College here in Atlanta. And I'm so excited to bring her expertise to the table, especially with her concentration in neuropsychology. And, she doesn't just teach and do research with her students, but she also is really engaged in the community, offering tips about brain health. So she's going to share some of her expertise with us today. Dr. Jean, welcome in. It's so good to have you with us today. I'm just going to go ahead and stop sharing my slides and share a little bit more about your presentation while you pull your slides up. And we're going to be talking a little bit about protecting your brain today, those of you who are in the audience, against age-related changes and cognitive decline. And, that is, again, one of the principles of our program is that there's a lot that you can do to strengthen cognitive reserves. So, Dr. Jean, I can see your slides. They are pulled up here for me. I'm going to be monitoring the session throughout the webinar today. So go ahead and get started, and I'll be in the chat for everybody in the meantime. Welcome in, Dr. Jean.
Thank you so much. I'm excited to be here. And just to check, you can hear me?
Yes, you're coming through nice and clear.
All right, sounds good. So I'm excited to be here and to talk with you all about ways to build cognitive reserve in older age, and how to kind of boost cognition and everyday functioning. And so we'll talk a little bit about it, and then we're going to do some activities. So hopefully, I've heard that you all are sort of pretty active in the chat. So I'm excited to sort of see what questions come up, but also kind of engage with you all via the chat to kind of go through some exercises together today. All right. So again, we're talking about building cognitive reserve and ways to boost cognition and everyday functioning. All right. So before talking about sort of what cognitive reserve is, I wanted to kind of go through this graph of sort of aging and the aging process and sort of what people consider as, wanting to have, perfect aging. And so I put that in quotation marks because that doesn't exist. And so I wanted to kind of go through sort of what are some ideal kind of aging and what people tend to want out of um, sort of overall, sort of how they spend their lifespan, and then some more potentially less ideal ways of aging. And so, if we look at this graph here, and hopefully you all can see this little red kind of dot I have floating around. So, on this bottom layer here, this is time in years. So, the more you go to the right, the more time that is passed. And then up here is overall functioning. So you can think of this as you're functioning cognitively, so your thinking skills, memory skills, attention skills, any kind of sort of brain thinking skill, or physical functioning as well. And so the higher, so the closer it is to the top, that suggests that someone is functioning at a high level in that area. So in that thinking skills or physical functioning. But as we go lower down here, that means that someone's functioning lower. So they're not functioning as well. And then in this gray area here, this gray shaded area, this kind of just represents a time or the time where someone is not functioning well. And so with this idea of in quotations, of perfect aging, it's that top line here. And so this represents for quote unquote perfect aging that from the day someone is born all the way to the end of life, they are functioning in a high manner with no changes at all. And we know that that isn't sort of the normal aging process. There are variations along the way that happen in our overall functioning and our thinking skills and our physical functioning. There are dips along the way. But with this idea, this kind of represents there's no reduction or no decline in everyday functioning or cognitive functioning. Then there's this sort of less ideal aging that we tend to think of as the years go by, it's just downhill. There's just consistent, progressive decline. There's sort of no time of optimal functioning. And there's a long amount of time spent in this gray area, which represents where someone isn't functioning well at all. And so there's more time spent in that area of not functioning well. And so that's typically less ideal. When we think about aging, we think about sort of our ideal time of aging or the ideal trajectory or way that aging goes. Is we want to, as mentioned earlier, is we want to remain as independent, as functioning as well as possible. And so what this represents here is this dotted dash line in the middle, where as time goes on, there are some changes that happen. You're not sort of functioning as highly potentially, but still functioning, functioning well. And then towards the very end of life, you're spending the least amount of time where you're not able to function in this gray area. And so that's what we would ideally hope is that the time in which we spend not functioning well, in complete dependence on others in all aspects is as small as possible at the end of our life. And so that brings, so of course, I got ahead of myself with some of my arrows and things, but the question really comes into play in this gray area here is what can we do to maintain functioning as long as possible? And that is the general question. And then, even in the face of having mild cognitive impairment, and you can replace that with other difficulties as well if you wanted to, but even in the face of this, what can we do to maintain our functioning as long as possible so that we're functioning as well as possible until sort of that closer end of life? And so this brings forth the question or the idea of the cognitive reserve hypothesis. And so before I go into what is cognitive reserve hypothesis, we have some slides that are going to talk about it, I promise, in the next slide. But I wanted to show just how this graph here is pretty similar to this graph here. So we talked about just functioning broadly, so whether that's physical functioning, brain functioning, cognitive functioning, those kinds of things. But with the cognitive reserve hypothesis, what I want to take away from this is that this line right here represents the point at which someone is diagnosed with Alzheimer's disease. And so someone with low cognitive reserve, which is represented by this line here, versus someone with high reserve. And we're going to talk about what high cognitive reserve is and what low cognitive reserve is. But the takeaway point here is that the person with low cognitive reserve is diagnosed with Alzheimer's disease in this graph at an earlier point than the person with high cognitive reserve, even though the person with high cognitive reserve is experiencing a lot of neuropathology. So a lot of plaques in their brain, a lot of tangles in their brain, which are indicative of Alzheimer's disease. So even though the person with high cognitive reserve is experiencing a lot of those brain changes, they've been diagnosed a little bit later than the person with low cognitive reserve. So this brings forth to mind, well, what is this cognitive reserve and what can we do to sort of make sure that we're in the high reserve group versus the lower reserve group? So cognitive reserve is the brain's ability to function cognitively. So those are those thinking skills, though the brain is withstanding some type of injury or illness. So the idea of cognitive reserve kind of came about when researchers were trying to describe individuals who they didn't have any symptoms of Alzheimer's disease during their lifetime. But when they looked at their brains after death, what they saw was that these people's brains showed those plaques, it showed those tangles, it showed the shrinkage within the brain. And so they had the brain changes that are consistent with Alzheimer's disease, but in their everyday life, in their functioning, they did not. Their everyday functioning and their cognitive functioning did not express or look like what their brain was representing. So they didn't have those symptoms of Alzheimer's disease that we would expect. So the memory, significant memory loss, changes, and other cognitive changes. So what was happening is that they were thinking that those individuals are able to, they didn't show symptoms of the disease while they were alive because they had a large enough cognitive reserve to offset the damage and continue to function as usual. So it's this idea that some people are better able to cope cognitively than others, despite both individuals or both kind of people facing the same brain illness. So, for example, person one who has lower cognitive reserve, they might have severe plaques and tangles in the brain. Um, Person two with higher cognitive reserve might also have severe plaques and tangles in the brain. But person one with lower cognitive reserve might be showing severe memory problems, while person two with higher cognitive reserve might not be having any memory problems at all, or maybe only mild memory problems, even though both individuals are experiencing severe plaques and tangles in the brain. So, how does this cognitive reserve work? So, I like to think of it as like a savings account. And so, you're making these deposits over the lifespan. A person is making these deposits over their lifespan, and the more deposits that are made over the lifespan, the more resilient the brain is when faced with difficulties. So it's like our mental backup system, and it helps your brain to stay sharp, even when it's facing those challenges like aging, normal aging, or some type of injury. And so cognitive reserve allows your brain to work around those damaged areas, or it allows your brain to kind of compensate by using other parts of the brain more effectively. And so a brain with high cognitive reserve, it's more efficient in how it uses the brain. So it's efficient in how it uses its networks. It recruits different pathways to do maybe the same task. Or it helps to reorganize itself to maintain functioning. So having high cognitive reserve truly just allows your brain to be more adaptive to the brain changes that are happening. And so some of those brain changes can include an injury like a stroke or trauma, or a neurological disease process like Alzheimer's disease. So then the question becomes, I've been diagnosed with MCI, mild cognitive impairment. Does building my cognitive reserve still matter? Does putting money into that savings account for my brain, those deposits, does it still matter? And the answer is absolutely. And so there's research that has found that for those with MCI, and we know that having a diagnosis of MCI just places a person at greater risk for dementia, but it is not sort of a definitive diagnosis there that someone will get dementia. But in this group, they looked at individuals with MCI, and they looked specifically at those who did convert over to being diagnosed with dementia. And what they found was that even though they converted over to having dementia, those with higher cognitive reserve progressed to dementia later than those with lower cognitive reserve. So again, it still goes back to our goal of functioning as well as possible for as long as possible. So, what are things that build cognitive reserve? How do we put into this savings account? And so there are tons of different things. This is not sort of an all-inclusive list here. And a lot of the things that are on here actually overlap with one another a lot. And so these are just a couple of different things that help to build cognitive reserve. So things like education, so the amount, the years of education, the quality of education someone has had in their lifetime. Linguistic ability, so being bilingual has shown to reduce or has been shown to sort of hold off on the time at which someone is diagnosed with dementia. Physical activity, exercise, being socially active and engaged, in having leisure activities, and nutrition and managing stress, especially chronic stress. Also, occupational complexity, so that how challenging someone's job was during their lifetime. All of these different factors help to build that savings account that we call cognitive reserve. And so, with that, if we think about these cognitive reserve, or we'll call them cognitive reserve factors, the lower 2/3, so these two rows I've highlighted here with these sort of red circles, the reasons why they're highlighted is because these are the ones that are more likely to be more to for someone to engage in even in older age. And so this isn't to say that education, you cannot sort of change that, right? Because technically you can take more classes, but that also falls into leisure activities and cognitive activities. And so that's one of the reasons why I just kind of circled these last two rows here. Again, occupational complexity. So maybe you're retired and so you're not working as much, but you can volunteer or get a part-time job and again build sort of that area of cognitive reserve. But these two rows tend to be the areas that we focus most in. And so these are, I can go into detail about each one of these cognitive reserve factors and what kinds of things to do to engage in them and how they're beneficial for the brain. And so I have some slides related to those towards the end of this towards the end of the presentation that we can reference. But what I typically tend to find is that we kind of know sort of broadly, sort of, nutrition is good, exercising is good, being engaged, socially active. These are all good things to engage in, and their brain healthy, their heart healthy things to do. And, we're supposed to do them. But it's the how do I incorporate this into my everyday life for real kind of thing? How do I actually, make a goal and set a goal so that I can, I'm noticing that I'm not as socially active. And that's an area that I want to boost up a little bit. How do I go about boosting that area up in my everyday life? And so I'll spend some of our time focusing on that. And then we can backtrack and talk about, okay, what are some types of social activities that we can engage in and how are they beneficial? So when we're talking about cognitive reserve factors and we're talking about how do we start to engage in these activities or engage more in these activities or these factors, we want to set goals for ourselves. And so you might have heard of something called SMART goals. And so these are specific, measurable, attainable, / achievable, relevant, and time-bound objectives that are designed to provide clarity and focus. So sometimes we say, I'll give myself as an example. I want to exercise more. I want to get more physically active. And I have this broad goal. But how do I do that? How do I make it realistic? How do I make it, how am I going to be more physically active? How am I going to exercise more? How am I going to track that? How am I going to measure that? And so SMART goals really help us to break these things down so that we can actually do these things. So, with SMART goals, the S stands for specific. So, your goals need to be specific, narrow, well defined. They need to be measurable. The M is for measurable. So, you need to be able to track your progress with numbers or clear indicators. It needs to be attainable or achievable. I like to as well. And so attainable means, is this goal realistic based on my abilities, my skills, and my resources? So is it realistic for me to have a goal of running a marathon when I personally have not ran a mile? So we might need to, adjust. We can get to that marathon level, but we might need to adjust our goals so that it can be a bit more realistic. Um, and then the R stands for relevant. So they should matter to you. It should matter and align with your goals, something that's important to you. And it should be time bound. So you want to set specific deadlines for reaching it. It's specific, want to get as concrete as you can to help you achieve these goals. And when we're thinking about incorporating these cognitive reserve factors, I always like to think about and consider what are potential barriers. So when we start with SMART goals, it feels sometimes like this is like, yes, this is optimal for me. I am excited about it in the beginning. I can see myself doing these changes. But what might get in the way of completing those goals? So you have to be real with yourself. You have to know yourself and understand yourself. Or if you're working with a care partner and you all are trying to figure out, well, what might be realistic for my loved one. So wanting to make sure that things are realistic and that you're thinking about what barriers might be in the way. Some potential barriers, and this is just a small list of many barriers. Things like limited mobility. If so, you want to think of ways for it to be the goal to be accessible, friendly towards any adaptive needs. Lack of access to a resource, personal motivation. So if you know what, I am not motivated to do this at all internally. I need some type of external motivator. So I need to, once I do this, I need to reward myself immediately because I know it's not going to happen internally. It's perfectly fine. But think and consider about that potential barrier so that you can plan ahead to address those barriers. Other barriers could be weather or unexpected change of plans. So for me, as soon as it rains, there's no going outside, even a little drop. If there's one drop, there's no going to the gym for me. So in those kinds of cases, if there's a week or two of rain, what am I going to do? Am I not going to go to the gym at all? Or do I have backup exercises and routines and things like that I have prepped that I can do at home? In those situations where there's an unexpected change. Time could be a barrier. Not preferring mornings or knowing that you don't like mornings. So don't set a goal for, I'm going to wake up and do this, this activity that starts at 5 a.m. when you're not a morning person. Of course, you can work, if a goal is to work towards being a morning person, then you can make some adjustments and changes based off of that. Cognitive ability. So if attention is a difficulty, how can you structure your goals so that it can be conducive to your attention span? So instead of saying I will read a book for 2 hours, if you know that you'll get distracted and there are lots of things going on and those kinds of things, you might want to chunk that down a lot more. And it might be more reasonable to say, I'll spend 20 minutes of reading or even 10 minutes of reading or whatever that number might be for you. Transportation could be an issue as well. And so thinking about that as a potential barrier. So always considering what might be potential barriers for you and how can you think of those barriers beforehand and try and address them and plan for them beforehand as well. So before we go into before I go into the list of different cognitive reserve factors, I think what I will do is I'm going to change my screen. So I'll take a little bit of time because I want to show some different things, show you all some different things. So we're going to go through, I'll give you sort of a heads up look. We're going to go through a case where Jane Doe is trying to increase their physical activity. And so give me 1 second to set up our situation here, and then I will reshare my screen. All right. So, what I'm going to show you in a bit is going to be a screen that has two things on it, two pieces of information on it. So, we're gonna start using our cognitive flexibility here. So I'm gonna reshare my screen, and we're gonna do sort of an activity, thinking about these SMART goals. All right, so on my screen, hopefully on the left, you're seeing sort of a slide that says case physical activity. And let me pull that up maybe a little bit more. And then towards the right, you hopefully should be seeing a screen that says uh, case, and it says specific, measurable, attainable, relevant, time bound. So this is the SMART goals. So in the chat, I would love for you all. So we're going to work on these SMART goals for Jane Doe. So Jane Doe is a 76-year-old woman who was diagnosed with MCI 2 years ago. And so they have, four grandchildren in their 20s who visit regularly, so about 2 to 3 times per week. And some of Jane Doe's values are family, relationships. Jane Doe values independence and also values their alone time. And so she's realized that she doesn't move her body as much, often spending much of her time doing activities that require low amounts of movement or minimal movement. And so Jane Doe is wanting to increase her physical activity, but isn't not sure of what to do and where to start. And so we're going to keep all of that in mind. So we're going to go through these SMART goals. And in the chat, we have some options. So I want you to identify whether A is the best option, B is the best option, or C is the best option for each goal setting. So we're going to start with specific. So for Jane Doe, they are wanting to do physical activity. And so what is the best specific goal for them? So is option A is want to be more active. That's pretty much it. Option B is want to engage in physical exercise at least 3 times per week. And option C is want to consistently attend Tai Chi and or go walking at least 3 times per week. So which one is the most specific goal here? So I'll give some time for some things to get in the chat. Okay, I see a couple of different C's. Okay. All right, so everyone is pretty much saying C. So what I'm going to do here is just highlight C. All right, so we know that Jane Doe has this goal of being more physically active, and it sounds like the best specific goal here is wanting to consistently attend Tai Chi and or go walking at least 3 times per week. So we have specific information about what kind of activity Jane is interested in doing, and also sort of what, how often, she's interested in doing that. So now we go to measurable. So how are we going to track it? So A, how many times did Jane go walking or do Tai Chi? Or B, Jane will use her app or calendar to track how long she spends walking doing Tai Chi. A or B? All right, so for measurable, Okay, you all are professionals here. You all are saying B. Most of the answers are B. And so while A isn't bad at all, how many times did I go walking or do Tai Chi? But B is it has more detail into it. So using something to keep track. So it not only keeps track of how often, but also how long. And so with that, Jane can over time increase how long she's been doing Tai Chi or how long she walks. So it gives room for you to start at 5 minutes and move to 10, move to 15, move to 30 minutes as time goes on. Great. All right. So when we talk about attainable, realistic based on skills and resources, A, since Jane doesn't move much, she will start with working her way up to 3 times per week. Or B, as in boy, begin her goal at 3 times per week. All right, let's see. Checking the chat. Okay, I see. Okay, a lot of A's here. Good amount of A's. So we're going to highlight that. So again, you want this to be realistic based on skills and resources and based on yourself and in your history. So Jane is going from not being physically active at all. So you want to start working your way up to 3 times, even though that's the end goal. You want to sort of start at, 1 day a week, then 2, then 3, so that you can gradually see those successes and gradually feel confident in yourself, and then challenge yourself a little bit more, and then challenge yourself a little bit more, versus sort of starting right at 3. And the reason being is because if the goal is to start working out or doing Tai Chi 3 times out of the week, and you're noticing the first couple of weeks you're not meeting that goal, it's really discouraging. And then it might discourage you not to continue at all. And versus starting slow, starting steady, building that foundation to get to that point. All right, you all are doing an awesome job. All right, so relevant. So this doesn't have an A or B here, but we want to identify that this aligns with Jane's value. It aligns with her value of maintaining her independence, because we know that Tai Chi and also walking is helpful for physical functioning, and not only physical functioning, but cognitive health as well. And those physical functioning and cognitive health are both highly related to independence. And so that aligns with her goal. And it also aligns with being able to keep up with the grandchildren that are coming very often to visit. And so it allows her to be engaged with them, continue sort of conversations, and being able to kind of hang out. So we know that it aligns and it's relevant for her. And then time bound. So option A, go with the flow until her goal is reached. Or option B, wanting to reach her goal of 3 times per week by May of 2025, when the family is on summer break. So for time bound, option A or option B. All right, I'm seeing mostly B's here. And so for A, going with the flow until your goal is reached. The difficulty with that is that you don't really set a goal for yourself, and so it allows for you to kind of slack off a little bit. But when you have a goal, even if that goal is flexible, so remember, life happens, things come up. We could say her goal is for May of 2025, but in March, maybe something happens and there's been a change. Maybe she's had to move. Maybe there's been some changes in her. Maybe the Tai Chi course that she was engaged in has stopped for a little bit, and she's sort of in flex of looking for another group to be around. So you always do want to have this flexibility and not sort of be hard on yourself if you're not able to reach that goal, but it is good to have it. And that way you can keep your mind determined and kind of engaged. All right. And then barriers. So are there any barriers that we can think of for Jane Doe? With the limited information that we know about Jane Doe, what are some things that we want to keep in mind about things that might be difficult for her to engage in physical activity. What are some potential barriers? Feel free to drop anything in the chat, anything that might be a barrier for Jane Doe or anyone who might be in this kind of situation, who's wanting to increase their physical activity and going from very limited movement. And so as I'm waiting, great. Yep. These are great. So we have barriers, illness, pain, injury, health issues. She might be busy. These are great barriers that come up a lot of times. And so, especially since she hasn't been moving a lot, weather is a great one. Yep. And so we want to think about all these different barriers. And so since she doesn't have a history of moving a lot, then we're not going to say that, Jane Doe needs to be doing sort of like hardcore lifting weights and all those kinds of things. Again, you want to start gradual. It might be the case where Jane just does chair exercises, and that's the physical activity. And that might be very beneficial for any issues related to pain or anything like that. If an illness comes up, being okay with, you always want to prioritize things, right? You have to prioritize your overall health. And so it's okay to reduce some of the physical activity if there's an illness, if there's something that happens. And then, of course, always keeping in mind that with any changes in physical activity, we are talking with our medical providers, with our physicians to identify what is the best exercise, at any, what kinds for your body personally. So these are great. Yes, love these. Love these. Yeah, potential for injury without a care partner being around. Love that. So a potential barrier might be, when the care partner isn't there, Jane might not be able to do an exercise. So she has to structure her physical activity routines based off of the schedule of her care partner. So keeping that in mind. Love the engagement in the chat, everyone. Thank you all. All right, so that was a great exercise with that one. And so why not do another one? All right, so we're going to do John Doe and a very similar style. And so John Doe, this one is focusing on social engagement. So John Doe is a 64-year-old retired man with mild cognitive impairment. John Doe has lived alone for the past 35 years, describes himself as an introvert, loves being alone, really values that time, and has minimal physical contact with friends and family, although they're very active online. So they, engage and, look at pictures of other family members, and engage online through different social medias, and different chat platforms. But in terms of physical contact, so everyday kind of in-person contact, not as much. And so one day John Doe was reading and saw the importance of social engagement in older adulthood and its impact on memory and overall well-being. And so John is interested in increasing his social engagement, but isn't too sure of kind of where to start. It's kind of that situation where you're like, the medication is good for you. You don't really want to take it, but you got to incorporate it and start taking it, right? And so how can we assist John in working towards this goal of being more socially engaged? And so we're going to start again with our SMART goals. So specific. So A or B? A, wanting to consistently participate in a group activity at a local senior community center. Or B, the goal is want to be more social. So which one is a bit more specific? So which one of these goals is a bit more specific? Wanting to consistently participate in a group activity at local senior community center, or just overall goal of wanting to be more social? All right, so I see a little bit of A's, a little bit of B's. I wish I could count these up, but I want to say just a little bit more A's than B's, even though both. So again, both of these are goals. A has a little bit more specificity in there. So, wanting to consistently participate in a group activity, although it doesn't say what the activity is, and it has the location, so the local senior community, versus wanting to be more social. That's more broad. I would say that's more of an umbrella. And then more depth, a little more under the surface is wanting to consistently participate. So, A is sort of a little bit more of a specific defined goal. Measurable. How will John track social engagement? It's kind of a weird way. So, A, number, of events attended per month. B, whether he went or not to an event. Okay, so I see mostly A's here. All right. Yeah. So the number of events attended per month is a good way to keep track. In this case, for how many social events did I go to, or am I going to? And so next, attainable. So we want to think about John's specific values and goals. And what is the more attainable goal here? Attend a social event twice per week, or attend a social event once every 2 weeks. And so let's think about John's background. Describes himself as an introvert, values sort of being alone, and doesn't really engage with individuals. So, what might be a more attainable, realistic goal for him? I'm seeing B's. I'm seeing maybe one or two A's. So, we'll go with B here. All right. So, again, given John's background, attending a social event once every 2 weeks is probably already a stretch for him. So you want the challenge, but you don't want to sort of overload with the challenge. And so going to an event twice per week might be way too much for John. But something a bit more reasonable, every 2 weeks, making sure that he goes to a social event might be sort of that sweet spot for him. All right. And then in terms of aligning with objective and values, so we know that he loves being alone. That's part of his, values. But attending a social event once every 2 weeks also kind of addresses his interest in increasing social engagement. So when we think about, let's say John finds a reading club or a sports league. I don't have an option here. So we're going to call this A, we're going to call this B. There we go. So for A, do we think that participating in a reading club with 4 to 6 other members versus B, participating in a sports league with 25 team members and multiple other teams, which one do we think is more falls in line with his, he's more introverted, loves sort of personal connection, but it also wants to be more socially engaged? Okay, I'm seeing lots of A's here. Yep. And so again, we want to balance you know yourself best. You are the expert on yourself. And so you want to balance your values, your goals, your what brings you happiness and comfort with also stretching yourself with engaging in these cognitive reserve factors. All right. And then time bound. So waiting until he's reviewed all possible social activities available through the senior center to begin, or spending 2 weeks reviewing the community center offerings, making a list of his top 2 to 3 social activities, and then by week 3, and then by week 4, beginning to attend meetings. Which one is more time bound, has more specific deadlines? All right, I'm seeing B. And that's yeah, right on it. So again, A is more of there's always going to be so much that you could look into, so much research that can be done. And so you have to give yourself some timelines. And I'm speaking to myself here as well. A lot of times I want to take in as much information and then I never actually do what I said I was going to do. And so you want to give yourself timelines for, okay, I've reviewed as much as I can. Let me make my top 2 or 3 list. Awesome. All right. And then barriers. What might be some barriers for John? And so we want to think about his background, anything that might be a barrier. Yep, a broken leg, that could be a barrier. It could be a barrier in multiple ways. So, one, might not be able to physically get there to these social engagements, but two, if John tends to be more introverted and doesn't, like to be engaged, now that he has a broken leg, that's also going to reduce his interest in wanting to be engaged with other individuals. Emotional insecurity, right? That's right. Not feeling comfortable or secure in these social settings. So again, wanting to start small so that he can move up from there. All of these are great things. And so thank you all for such a great discussion, for being so active in the chat and joining in this conversation. And so, as I mentioned, there are some further slides. Hopefully, you all are still seeing sort of the larger slide that says, that has the case on there.
Yeah.
Okay, perfect. All right. And then what I'll do now is I like to show this last slide. So we didn't go through all the different things that you could do: cognitive activity, social engagement, what they are, physical activity, nutrition, leisure activities, managing stress. But what I always like to leave people with is this resource from the Global Council on Brain Health. And so you could Google them. They have such great resources on what's good for the brain. And this kind of consolidates or makes everything bite-sized so that you can really just chew on a little bit of things about how important it is to be social, engage your brain, manage stress, exercise, sleep restoratively, and make best decisions as possible with eating. So I would encourage you all to look through, and if there are good tidbits here, take them away, and also follow the Global Council on Brain Health. And there are 6 kind of pillars, although we know there's a ton, but there are 6 pillars of brain health. And that is all that I have for you all for now. And if there are any questions that we didn't get to or anything like that, I'd love to work on answering those.
Thank you so much.
Sharing.
What a nice summary of encouragement, because I think sometimes, like you're saying, after a diagnosis, we think that the trajectory is moving into dementia, and that is just not the case. And there's so many things we can do to build that cognitive reserve. And we had some questions in the chat, and a nurse psychologist is the perfect person to ask because you really do know all about the testing. And one of the questions that we have is for people who have been, maybe diagnosed with a form of dementia, how can they know where their cognitive reserves are at? How do we have a very accurate view of where we are at in that line graph that you showed us at the beginning of the presentation? And how can we access that information?
Mm-hmm. Yeah. And so with that, it's that would be very much sort of looking back. Unfortunately, a lot of times a lot of providers don't go through and say, all right, now let's talk about sort of your whole life history and what are your cognitive reserve factors specifically. And so one thing that might be helpful as an activity just personally is to go through and think about looking at these different cognitive reserve factors of, okay, well, where are my strengths at in this area, and where are some of my weaknesses at in these cognitive reserve factors? So thinking about education, so sort of how many years of education did you have? What was the quality of that education? Understanding whether you're bilingual or not. Understanding how much sleep you've gotten over the course of your lifespan or not. And then from there, looking at what areas have you been really strong in over time, and what areas are some of those weaknesses. Some people have had insomnia from their 20s, right? And so the question then becomes, what areas can I boost up that are a little bit weaker to help support my cognitive reserve, especially if there are things that can be done to manage those. And so I would just recommend looking at it from more of a strengths and weaknesses perspective, which everyone has. So I can look at my own sort of list of cognitive reserve factors and kind of go through and say, okay, I need to boost this up. Looking at, physical activity, social engagement, what areas are a little bit where there's not much going on in that area. And what happens is when you increase that area, because especially if it hasn't been an area that you've engaged in before, it's something new. And so not only are you engaging in something that's good for brain health, but now you're also engaging in new learning. So it's almost like sort of a good benefit from that when you look at sort of your cognitive reserve factors over time. So it's a good activity to kind of look at sort of all the different reserve factors and where you kind of fall with that.
There truly is no effort wasted on the path of building cognitive reserves. You really can start with basic things like your hobbies and think about the things that you want to add into them. But we definitely always want to have that chart or graph that really kind of maps everything out for us. But like you said, you know yourself best. You know the areas of improvement that you need, and it's really turning our attention toward those places, sometimes that are hard to even look at or deal with, like sleep issues, which we know a lot of people in our population struggle with. And one of the things we say at CEP is that you don't have to do that alone. And there are people you can add to your team by letting your primary care provider know, your neurologist know where those spaces are. And sometimes it does require a little bit of vulnerability to really be open about the places that we want to grow, but no effort wasted on the path. If you were with us a few weeks ago, Dr. Goldstein was sharing a lot of the Lancet publication reviews from the past year that said, we can improve our memory like 30% from getting better sleep. Many of us have that opportunity to make those improvements. So thank you so much for coming and sharing with our audience today. For those of you who joined in the chat, thank you all so much for being active and willing participants. We also know it helps you recall information better. So that is something that we really appreciate from our community. And it's the last session of the year, so let's end it on that hopeful note of small steps make big impacts. And it's things that we can do even in the wintertime at home, from home, with the resources we have here, just starting something new. So